Yes, may I ask who's calling?
Hi, Carl. This is Jessica Clark on a recorded line with America's Health. I'm just calling you about the new food and grocery allowance. Have you received that benefit yet?
When was that supposed to be sent to me?
Oh, I'm not sure, sir. I'm just a pre-screener, so I'm just trying to get all the information to get you sent over for Medicare's Part A and B, and these are the benefits that you could be entitled to receive.
What company do you work for? I'm sorry?
America's Health.
America's Health. Where is that at?
Yes, sir. I'm not sure where we're based out of, sir. I think it's in Denver, but like I said, they just hired me as a pre-screener to collect this information
Sure.
get you sent over for Medicare.
Okay, who gave you my number to call in the first place? I'm on the National Do Not Call list and have been since 2004. So I don't know why you people would be calling me in the first place.
I'm not sure, sir. I don't know how they go about doing that.
Sure. So you guys don't check the National Do Not Call list before you start calling people, huh? Okay, well that makes sense. Who do you need to transfer me to so I can ask them about that?
I just need to transfer you to a licensed care agent, but they would only go over benefits with you.
Sure, let me talk to them because I want to find out why they had you call me in the first place.
All right, sir, just one moment.
Sure. I guess that wasn't going to happen. Despicable. But then again, most likely she was in the U.S. She didn't have a foreign accent, which means they're just breaking the law. That's all.
We are assisting all the victims who got exposed to toxic chemical, so we are getting them compensation. In the amount of $25,000 up to $200,000, depend on your case, alright?
Okay, well how do I get this compensation?
Sir, where you live or work at Camp Lejeune or anyone in your family?
Yes. Do I need to speak to an attorney?
Yes. So, confirm it on, sir. Have you got any kind of cancer or any kind of disease?
What's the name of the attorney I need to talk to?
It's a guardian. We are from the Guardian Law Firm.
I'm sorry, you're from where?
We are from the Guardian Law Firm Department.
Guardian Law Firm Department. Okay. Is there a specific attorney I need to speak to?
Yes, sir. So,
What's the name of the attorney I need to talk to? I'm just curious of who I need to talk to.
Sir, we are from the attorney with the law firm. It's a Guardian Law Firm Department.
Guardian Law Firm Department. Okay, that doesn't answer my question. Is there like a lead attorney? Is there a name? He wasn't going to answer. Hello?
Hello.
Yes, hello.
Oh, yes, sir. My name is David Walker, and I'm from American Claims Advisor, sir. How are you doing today?
Okay, how can I help you?
Okay, I'm perfect, sir. Thanks for asking. Actually, we are assisting all the victims who got exposed to toxic water at Lake in Camp Lejeune, sir, and we got them compensated for their pain and suffering, sir. So I just need to confirm that. Were you at Camp Lejeune in Jacksonville, North Carolina, sir, or anyone in your family?
Yes, I was. Is this like a referral line for an attorney?
I'm so sorry.
Are you going to refer me to an attorney? Is that what this call's about?
I can hear you, sir. What? Can you speak loudly?
Are you going to refer me to an attorney, is what I'm asking you. Are you here to help me get an attorney?
No.
No?
Actually, sir,
So how are you going to help me get compensation for this?
Actually, sir, the thing is that we are providing a compensation. We are assisting all the victims who got exposed to toxic water.
Okay.
Like in Camp Lejeune, yeah. And we are getting them compensated, sir, for their pain and suffering that goes in the amount of $25,000, sir.
Okay.
Up to $100,000, depend on how severe the case is, right? So you told me you was there or your loved one?
Okay, now I'm going to ask the question again because you didn't answer it. How exactly are you going to help me get this compensation? Are you going to refer me to an attorney?
No, I'm not an attorney. Actually,
I know that.
I'm from American. Yeah, it's a legal intake center. You got it?
No, I don't understand what you're talking about. I'm asking you, how are you going to help me get this compensation?
Actually, sir, it's a legal intake center, and we are filing the claims like anybody, like those people who lost a station here at the Camp Lejeune, they diagnosed with some kind of cancer, some like sickness. So that's why it's a legal intake center, and we are providing a compensation against, how to with the cases.
Now, exactly how do you help? Oh, hold on a second. How do you help people get this compensation? It's what I'm trying to get at. Is trying to figure out what it is you're trying to help me with. Are you just going to write me a check?
No. Actually, sir, if you are eligible for this compensation, so you will receive your compensation maybe in 1 week, or maybe a couple of days, or 10 days, or 9, maybe. So if you are eligible and if you are qualified, it's $200,000 compensation.
Yeah, there's a big difference between a couple of days, 10 days, 9 days, a week. You know, there's a big difference in that. What I'm asking you is, how do you help me get that compensation? What is it that you do? Do you not understand the question? No. All right, back-to-back idiots is what I got to deal with this morning. But that's okay, they'll call back. Frickin' A, you know what it is. They're trying to get you in touch with an attorney who's going to help you file this class action lawsuit and get this claim, but I can't get these people to admit what they're trying to do. Horrible, horrible people. But they'll call back and they'll try again. Yes, hello?
This is Sam. How are you doing today?
Very good, thank you.
This call is about a Medicare. Do you have Medicare Part A and Part B, that's right?
Yes, I do.
Okay. May I ask how old are you? Your age is 64, that's right?
No, 68.
68, okay. May I have your zip code?
What are you calling me about, Sam? What is this about?
I'm calling from Medicare is providing information Part A and Part B, that's right?
Well, I have Parts A and Part B.
Okay. Your zip code 34483, that's right?
Sam, what are you calling me about?
Your zip code 34483, that's right?
Sam, I'm not giving you any of my personal information till you tell me what the hell you're calling about. What are you calling me for?
I am calling from Medicare is providing information Part A and Part B, that's right?
Well, I have Parts A and Part B. What information are you going to provide me about something I already have?
Okay, what is your... may I have your zip code? Your zip code 34483, that's right?
Why do you need my zip code? Just some strange man calls me up and starts asking me personal information without telling me why he's calling me. Anybody else find that odd? They are definitely scraping the bottom of the barrel with these guys. These guys are dumb. Ugh.
For Police Officers Defense PAC. Sir, the reason for the recorded call is that the 527 organization, which supports the rights of police officers and citizens they serve, will be sending a pledge kit to all supporting residents. The goal of the drive is to support legislators who work to keep our communities safe, as well as support assistance to the families of officers killed in the line of duty. So, sir, when you receive your receipt and return envelope, can the organization count on your small one-time support?
Well, how much of the money is going to go to electing the politicians?
We are fighting to keep every dollar going to the Committee for Police Officers Defense, so there is no set percentage. But there are substantial fundraising expenses, the processing fees, and normal compliance fees. But the plan is to have enough funds left over to support the candidates who will truly help the cause.
Well, that's good, because I think this money should definitely go to the politicians. No need for the people on the front line to get this money. Politicians need it more than we do, more than they do, right?
You know, that's a really good question, and I don't want to provide you with an incorrect response. Now, if you would like to find out more information pertaining to the drive, I can give you a number to call.
Okay, sure. What's the number?
Sure. The toll-free number is 866-310-8282.
Now, what's the maximum amount of money that I can pledge?
Well, those levels are merely suggested, and every dollar counts. What is the minimum level you can comfortably help with?
Well, as long as you can guarantee me that that money's not going to go to anybody on the front line, that it goes directly to politicians' pockets, then let's start talking real money then. How much money do you need?
Well, thank you.
I was trying not to be mean, but as you can tell. They'll call back and we'll try again later.
Department of Healthcare, how are you doing today?
Okay, very good. How can I help you?
Good to have that, sir. As you know, the annual enrollment of Affordable Care Act ACA has been started, so you might qualify for a variety of healthcare coverages such as co-pays, deductibles, hospital care, and many more. I do believe you don't have any Medicare or Medicaid, is that correct?
No. What company did you say you were calling from?
I'm calling you from U.S. Department of Healthcare, sir.
U.S. Department of Healthcare. Okay, I got it. Why is it that everybody that calls me from the U.S. Department of Healthcare has an Indian accent? Do you guys just hire a lot of Indian people to work your call center?
Well, sir, I assure you that I'm not calling you from India or anywhere else.
Didn't say you were calling from India. I said you were calling from the U.S. Department of Healthcare, but that you have an Indian accent, and that everybody that calls me from the U.S. Department of Healthcare has an Indian accent.
I'm not sure, sir.
I'm just pointing out an observation, asking you a question, dumbass. They'll call back. We'll do it again. Yes, hello?
My name is Alvin Brown from U.S. Healthcare Department. How are you doing today?
Okay. I spoke to somebody from the U.S. Healthcare Department earlier this morning.
Sir, we are calling you to make sure you are not missing out any benefit that you are entitled with. While you are receiving this call, because you can qualify for a variety of healthcare benefits, which covers all of your co-pays, deductibles, or even free for the citizens who are making less money. So I do believe you don't have any Medicare or Medicaid.
You know, after the first call I got this morning, I went online to Google the U.S. Healthcare Department or U.S. Department of Healthcare in order to call you guys back. There is no such thing as the U.S. Department of Healthcare. Did you know that?
Are you interested or not?
You did not hear what I just said, did you? I got to repeat it. Okay, I'm sorry. Oh, no. Yeah, there is no U.S. Department of Healthcare. That acronym, that terminology does not... Hey everybody, and thanks a lot for checking out the video. If you like the content, click the subscribe button and hit the bell for notification. Leave us a comment. Let us know what you think. Thumbs up, thumbs down, either way, and we'll catch you all next time.